Good afternoon, everyone. For those who are on the West Coast or Central Time, happy to have you with us. My name is Rita Lewis, and I'm Deputy Director of Clinical Quality Improvement at the National Association for Community Health Centers, and want to welcome you all to the Million Hearts SMBP Forum here today on June 8th. Very happy to have you all here with us. So we are going to be using the chat to communicate with each other and to share information, ideas, post questions. So please, when you're in the chat, be sure to select everyone so that we all can see your amazing questions, including our panelists and our speakers today. As a disclaimer, you know that we're going to have a lot of great information, but those who are sharing today are not necessarily speaking on behalf of the Department of Health and Human Services or the CDC, but we look forward to having a lot of great information shared with you today about SMBP. Now I'm going to turn it over to Judy Hannon of the CDC to share a couple of updates before we join into our call. Judy?
Thanks, Rita. And I thought I would start today's call with a little comment about the air quality concerns that are going on. I know it's not related to home blood pressure monitors, but probably everyone on this call does have connections with people who are at risk for cardiovascular disease, and really wanted to enlist everyone's help in spreading the word about the connection between air quality and heart attacks and strokes. And what you have here is just a number of things that might help you spread that word. There is a wonderful post by EPA, a LinkedIn post today that gives some really specific advice about what to do, including that masks N95s, not cloth masks, can be helpful if you need to go outside during the poor air quality days. And you'll see the rest of some of these links as far as being able to see the airnow.gov to show what the current standard is, information on our website about particle pollution and heart disease if people just haven't been aware. But again, I think getting the word out there about the connection of heart attacks and strokes and what people can do currently. It is really concerning when you go on the AirNow site and you see how red to purple the air is in the Northeast. So whatever you can do to help spread the word, giving advice to people about what they need to do and the connection with cardiovascular health would be greatly appreciated. And with that, we'll turn to the topic at hand, which is SMBP. And my job is just to welcome you. Thank you for making the time today. We will be giving a poll also on what are your SMBP implementation concerns. And today's topic actually comes from those of you that have answered the poll so far with one of the #1 issues that you all were asking for some additional advice on was areas related to patient engagement. So how do we engage the patient in this SMBP? We've got two really great speakers, Dr. Kate Curley from the American Medical Association and Deb McGrath from Health Federation of Philadelphia. They're going to talk about their experience and some suggestions that they have related to patient engagement. And then we'll have an open discussion looking for your tips and tricks related to patient engagement, as well as your biggest challenges that the group itself can help, as well as our esteemed presenters today, and finish with some resources and updates that we hope are helpful to you all that are implementing SMBP. As you see on the next slide, our objectives are to share content and resources that you all have requested about SMBP, and to share information about how to best engage patient in SMBP. And we have plenty of time for questions and answers, so that's a forewarning. Think about your questions right now. You can start putting them in the chat at any time, but a reminder that this SMBP forum is intended to be a forum. So we are looking for both questions and answers from those of you that are on this call. Next. And with that, I'll turn it over to Rita. And we really do need your continued input as far as what are some of the challenges that you have. Rita?
Thank you so much, Judy. So as Judy mentioned, we did send a poll out, I believe, last month, and a number of you did respond, which is how we landed on this topic of patient engagement. We did receive a number of other ideas, but we really want to make sure we hear from the broader audience. So we're going to just take this a minute or two for everyone to open the link either from the chat, or you can pull out your phone and scan this QR code. It will take you to our survey. It may look familiar for those who have completed it, but we refined it a little bit just to make sure we're honing in on the most important issues that are concerning people when it comes to SMBP implementation. We want to make sure that we're taking the time to make these forums most impactful, most targeted, the information that everyone here needs, and to make sure we're getting the right experts who can bring the right information to you. So please take a moment to just pull up the link. I believe it's now in the chat. And you can use your phone for the QR code, but we just want to make sure that we get enough voices heard and that we're on the right track to getting the right information on these forums and making it really the best it can be for everyone, because this forum, as Judy mentioned, is meant to be a space for information sharing and bringing new ideas and bringing best practices, but we can best do that if everyone contributes to that. So with that, I hope everyone has had a second to pull up the link, start to complete the survey, but please take a moment to complete that as we're moving forward. But I just wanted to take a moment to allow everyone that opportunity to make sure that they were providing their input for this survey. And with that, I will turn it over to Dr. Kay Curley of the American Medical Association and Doug McGrath of Health Federation of Philadelphia. They are going to bring to you some really great information as we think about patient engagement from the provider and care team perspective. They've pulled together a lot of great resources and pulling it from the national level and on the ground level to what may be most impactful to all of you implementing SMBP. So I will turn it over to them.
Thanks, Rita. This is Deb McGrath, and I am very happy to be here today. Thank you for allowing us this time. So real quickly, we're looking at some promising practices to activate patients. Imagine ways that you can engage your patients. We hope you'll leave with that concept and maybe be able to list or access some of the SMBP and patient education resources that are out there and available. Next slide, please. I know this is a busy slide, and please forgive my throwback to being an academic here, but I think we see these models all the time, and what I wanted to do is take this model and really help us understand how SMBP fits into this model. And I'm going to start at the left side of the screen, which talks about the activated, informed patient. And this is where we teach patients about SMBP, enroll them, provide them with resources, and enlist our community partners so that we're all giving a similar message. And that's this sort of self-management support and developing the personal skills that comes into play here. The decision support piece, there's an SMBP toolkit that we reference all the time. There are resources around single pill combinations and algorithms for treatment intensification that I really hope you are all either using or will begin to use, or let us hear what could make them better to use. And then the SMBP team, so you have to have a prepared and proactive practice team that's ready to roll with SMBP information. So taking the time to identify those team members, defining their roles and responsibilities, setting expectations, and also thinking about how you're going to evaluate success from the beginning if you're not already. And some of those are, data that you have to send places, but also what's your internal view of that, or your internal measure of success. Now I'm going to talk about information systems. A lot of you know me with my role in information systems. And while there is some integration with the EHRs out there, it is a challenge. And I think we have to think about ways that we can maximize blood pressure repositories, clinical portals, and be, really talking to our EHR vendors about how this information is presented at the point of care in a context that people can really relate to. Next slide, please. So this is just a slide that kind of hopefully enlists why this is an important thing for you, what you'll get out of this, or what meaning having a team approach to this has. We know that it reduces workload and burnout. We know that it improves efficiency, quality of care, and a positive patient outcome. But what I want to make sure we leave with today is understanding that the patient is as important to this team as anybody else from the health center, and thinking about how we can make sure that patient has the knowledge, the skills, and the attitude. And when I say attitude, what I mean is really feeling incorporated into the team. Next slide, please. This is a screenshot out of the SMBP toolkit, which I think is incredibly useful. And I've highlighted those areas on this screenshot that maybe you could be thinking about as you are looking at your team and who could be doing what. But think about what are the roles and responsibilities are needed, who has the capacity, who has the skills, and or who might need training to be able to really fully activate that group of patients. Next slide. So what does this mean to you? Improved outcomes, an improved clinical experience, and we've heard providers tell us how it's bringing the joy and satisfaction back to their practice because they can really see a cause and effect. We are going to be, the next section is going to look at the patient experience. Patients get more attention from multiple team members, and it does improve retention, it does improve engagement, and it's lower cost by and large. Next slide, I believe, goes to Kate.
Yeah, thank you so much, Deb. And just getting into some more specifics about what we can do to really create that informed, activated patient who is really engaged in SMBP. I think it really comes back to making sure we set our patients up for success from the very beginning. And good training on how to do SMBP properly is really important in this process. And like Deb was just highlighting, who does this training does not need to be a licensed healthcare professional, right? It could be many members of the care team. So whoever that SMBP support team members may be, your enrollment specialist, you want to make sure that they are well trained to train the patient and educate the patient properly. This slide just highlights some of the key aspects of good patient training on SMBP. We want to make sure that we assist our patients in selecting that validated SMBP device and making sure it has an appropriately fitting cuff. We want to make sure our patients really understand all the important steps of preparation and positioning so that they can get that accurate measurement and that they really understand those steps well, so that when they go home, they really feel comfortable with what they're going to be doing at home. Ideally, we want to train our patients using the device that they will actually use, so they're comfortable with that device. We want to make sure they understand how frequently they need to measure their blood pressure at home, so twice in the morning, twice in the evening, ideally for a week. We can work with 3 days of data, and we want to give them a log that they can document on. We always recommend using a paper log, even if they're going to be capturing their readings digitally and transmitting their readings digitally. Having that paper log is a good thing to have as a backup. And also, it's another patient engagement tool when patients can write down their blood pressures and really see how those are changing or not changing over time. We always want to make sure our patients restate this information back to us. Ideally, they teach it back to us. We use teach back to confirm that they understand. And then we want to make sure that we have an agreed upon communication method and a communication plan with them going forward. So if we go on to our next slide, we can talk a little bit more about getting that data back from our patients and using it for our clinical decision making and folding that into our communication. So like I said, our patients are going to capture their SMBP results. There's multiple ways that they may be able to do that. And you want to use the way that's both feasible for your patients and feasible for your health centers. Then the patient's going to be sharing those results back with your care team. Again, this could be a digital means. This could be bringing in their device. This could be sharing that paper log with you. Again, some flexibility, but some clear process to keep your patient engaged. The care team is going to want to then average your SMBP results, interpret the results. And then we get to this important piece about documenting our treatment plan and really communicating that plan back to the patient as another step in keeping our patients engaged. And if we go on to the next slide, when we think about how we're going to communicate these plans with our patients, it's so important to remember, as Deb was saying, the patient's part of our team, right? So any processes that we come up with for how we're going to communicate with our patients needs to take into consideration how are we going to involve the patient in this conversation about what's the next step in their treatment. So we want to make sure that we are talking to our patients or connecting with our patients about their treatment plan in a timely fashion. So if we're not going to be able to get back to them in a day or two after they get their SMBP measurements to us, we want to make sure that they understand that. So for example, if you're a clinic or a health center that is not going to review SMBP data on a continuous basis, perhaps you have a team member who does that on a weekly basis, it's important that your patient understands that someone's going to look at this once a week and we're going to get back to you shortly after that. So you're not going to hear from us right away. Again, the patient knowing what is coming is going to help keep them engaged. We want to work with our patients to determine in advance how they're going to communicate with us. So that could be through the portal, phone calls, in-person office visits. And when we create processes for how we will develop our communication plans, we want to try to have a few options available to our patients. And then as we plan our process and how our care team members do this, again, we always want to make sure we build in that step of ensuring that our patients really understand their treatment plan going forward. And that can oftentimes, again, be done through teach back, where we have our patients explaining back to the care team member what their plan is. If we go on to the next slide. So we also want to make sure that when we're interacting with our patients, we're always using collaborative communication strategies, also very important for patient engagement. So that involves things like open-ended questions when we're talking about adherence, whether that's medication adherence or SMBP adherence, and always in that open-ended fashion, exploring reasons why patients might not be able to adhere to their plan, and really eliciting their views, their opinions, their ideas about how to address any issues that they have and really their priorities for their care plan. Using non-judgmental language, it's something that I think we all think we're good at, but we have to keep remembering, to think about how we're saying things to our patients so that we can remain non-judgmental. And again, I've said it twice already. I'll probably say it 2 more times before I'm done in a minute. Use teach back to ensure that our patients understand their plan. Next slide. If you've heard me talk before, you've probably seen this slide before. I'm not going to go into the details of this. This is one way to use SMBP to follow up on our patients. The take-home message here is a way to keep our patients engaged is to adopt a predictable follow-up plan with them. So we want our patients to know that we're going to follow up every 4 weeks until your blood pressure is controlled. We're going to keep this regular cadence. Also, everyone on the care team should know that this is our regular follow-up plan that we use here. And that can, again, keep your care team on the same page, but also keep your patients engaged. And then next slide. Just a couple more takeaways about maintaining patient engagement with the treatment plan. Whether it's initial SMBP readings or ongoing SMBP readings, again, make sure your patients know exactly how often they're supposed to perform SMBP. Develop a process for your clinic to outreach to patients as needed. And this is another place where you can really draw on the strengths of the care team to keep the patient engaged. So that could be regular check-in calls for your patients using SMBP. You want to make sure you have a way of tracking who is conducting SMBP and when you're supposed to receive readings from those patients, so that if you don't receive those readings on time, you can actively outreach to those patients to find out what's going on. And you want to have a member of your care team who's responsible for that. Again, make sure your patient understands all instructions. This includes things like when should they notify you? So not just when should they give you their SMBP readings, but what are other reasons they should get in touch? If their blood pressure readings are too high or too low, or probably most importantly, do they have any concerning symptoms? We just want to make sure they always know what they should do if they have any concerns. And then again, that regular follow-up and trying to stick to that follow-up cadence. And in general, what we've seen is that patients are motivated and we can help keep them engaged when they have more frequent touches with the care team. So look for ways to create those touches with the care team. And then Deb, I think I'm handing it back to you to wrap this up before some questions. Hope you're on mute.
Real quickly to summarize, adopting a team-based approach will capitalize on the strengths of your team, clearly identify members of the team and their roles, setting expectations, recognizing that the patient is a member of the team and their knowledge and their skills and attitude toward SMBP need to be supported. And then developing the technology that supports the effort can really go a long way to making this pretty efficient and reduce workload around it. So I'll end there and would love to hear questions.
And was trying to quickly get myself off mute. There is a good question and an answer in the chat. So Sarah Eve asked, has anyone developed a patient-facing document that talks about the patient's role in SMBP? And Natalie, I'm not sure where you're from. Natalie Andrews says that they have developed a flyer that she's willing to share. If there's a link and you could put it in the chat, that would be great. We'll make sure that everybody gets it afterwards, but also that question for you, Deb and Kate, if you're aware of some patient-facing documents that talk about the patient role.
Off the top of my head, I am not familiar with exactly what's patient-facing. I do think you're going to get the perspective of the patient in this next segment, and I think you'll hear some of he will be talking a little bit about his role, but I would love to see the ones that are in the chat.
Yes.
Yeah, and I think related, there are some good resources out there. I think, AMA has some, certainly Million Hearts has some, as well as Target BP, that help remind the patient about all those sort of proper positioning, preparation, all those steps to get that accurate measurement. So that's a component of that, I think, and some other resources out there in terms of that recording log, which also includes some instructions on it about when you're supposed to be measuring and how to measure properly. So we can maybe drop some links in the chat.
I really love the tone of that question, though, and the concept that we need to be not necessarily bite-sized information, but really honing in on they do have an important role. And I'm thinking about the document we developed a number of years ago about the variety of roles in SMBP, and there is a patient-only role. We may want to do something with lifting that up of saying, like, these are all the things the patient has to do as a sort of a part of a contract. Let me ask another one or two questions of you, and I'll ask it and then I'll keep looking at the chat. I'll put two out there. How do you sell SMBP to a patient? The engagement feels like it really starts right at the beginning. And so curious about your selling of it. And then my second sort of follow-up question is, and if you aren't getting results back from a patient, so they clearly are not engaged, they've got a monitor, you've taught them, but you're not getting, what is some of your advice in that scenario? So I'll let both Deb and Kate think about answer those two questions while I see what else is in the chat.
I
Kate,
can start, Deb.
Yeah, go ahead.
Yeah, in terms of selling patients, so one thing that comes to mind is actually so many of our patients are already measuring at home, but they're not necessarily sharing their readings back with their care team. They may not be doing it in sort of the proper fashion. So oftentimes you don't actually need to sell a patient on it. They're already doing this. They just haven't been connected with you. And so then the conversation is really more about making sure they're doing it properly. Do they have a validated device? And how are they really going to connect those readings back to you? Otherwise, in terms of sort of selling it to patients, I think it comes back to a lot of the tenets of shared decision making, as well as motivational interviewing. Where does your patient's motivation ultimately lie? Why would they care about their blood pressure control? And do they want to have more sort of autonomy and the ability to self-manage better. And if you can engage your patient in those concepts, then it's less of a selling issue. But Deb, do you have anything you want to add?
Well, I want to, Kara Barnett just put a comment in the chat about thinking about working on the community clinical aspect and having Healthy Heart Ambassador as part of this. And I think that you're gonna meet a patient in a couple of minutes who is we're in a community setting. We're at a church, actually, the church that he attends. And what's been very interesting about that group of patients is they are by and large very faithful about taking their blood pressure readings. And we're fortunate in that we can see on a clinical portal who is submitting and who isn't. So I would also talk about the use of technology, because then you can do outreach very easily and quickly for that group that maybe isn't submitting as much. And I would say the other secret sauce is engagement in between the visit, interaction, whether that's through a text message, whether that's through a phone call, and really maximizing that team. Yep, weekly text messages to enroll SMBP patients. Yep. We find that the texting is pretty powerful.
And I was just going to repeat that in case some people are listening and not being able to read
Yes.
the text. Angela said that they've had great success with patient engagement when they started weekly text messaging to enrolled SMBP patients with healthy education. And, so they change what the text messages are, but you are engaging the patient in both the SMBP results and sort of the lifestyle interventions, which are great. And I think you guys have hit on it, but there was one comment in the chat about just the biggest frustration getting patients to want to participate in SMBP. And so any last thoughts about that? There was an answer in there about selling SMBP as how to be a better advocate for yourself, the sort of patient advocate. But any other quick tips or pearls that you have if you had a patient in front of you that seemed hesitant about monitoring their blood pressure?
I would suggest you can say to them, you can do this. This is absolutely something you can do. Sometimes I think they think it's overcomplicated, and it really, when you get down to it, it's something they can do, and really encouraging them to say, not only can you do this, but we really need you. We need you to be a part of this.
I think reassurance that they have help all the way. For
Yep.
some patients, it may actually be an opportunity to reduce their medications.
Yep.
Because oftentimes we're overestimating their blood pressure when they're measured in the office. So sometimes that's an
really
incentive.
good point.
Yeah.
Yep.
And then I think really digging into the barriers, because for so many people, it's really practical, day-to-day challenging barriers that are their issue. And oftentimes we can address those or remove those or find a workaround for them to make it more feasible for them.
Thank you. I love both of those answers. Deb, as you were saying that you can do it, it just struck me how much people might think of this as a medical procedure because it's happened historically when they go to visit a doctor. So the concept, I'm not a doctor, I'm not a nurse. I think that encouragement that they can, as well as the benefits to them of potentially reducing their medication. And I would assume some of the other benefits are reducing your need to come into the office because we have good data from you, might all be things to help engage patients. Awesome. And I've probably gotten behind now that there are some new messages. Anyone else on the team see another question in the chat that I have missed or have a question themselves they'd want to throw to our panelists?
Judy, there is one from earlier from Allison Smith that we might want to address. If I can find it here, maybe Allison can come off of mute. I can't find it quickly.
The one about leadership, is that the one you're?
No, it was this one. It was, how do you handle the question about the duration and intensity of monitoring from patients and providers? how long do I have to do this?
Do you mind if I just take that for a second?
Go for it.
I would refer you to the clinical pathway that is in the most updated SMBP toolkit. We worked collaboratively on that, and I think it gives some good framework for how long, for what do you do at each phase, and how do you inform the patient. But I think that we could really work on more patient-facing things about that, what their role is, for example. But I think that does give some real good framework for it.
And Deb, I just want to follow up your comment with, there's another comment in the chat, or the question in the chat about, have you found any best practice recommended frequency for following up with patients throughout the program? And I think that's also in the example workflow, correct?
It is, but also what Kate had on the screen earlier, in that, enrollment, 2-week, 4-week follow-up is really a pretty good cadence, especially if you're doing intensification. You want to give the medication intensification a minute to work, but also help the patient to understand that this is their contribution to tuning those medications to a place where they're in a really good, comfortable, predictable place.
Thanks, Deb. And the last thing I'll say, and I'll turn it back to Judy, is, one of the things that the NAC group found out in our Accelerating SMBP project is sometimes it just the engagement of patients came down to their understanding that this was not like SMBP forever scenario, them understanding that it's a tool to get to blood pressure control, it's a tool for management, but because we're asking them to do this, we're not asking them to do it every day for the rest of their life. I think that was a real misconception. So if you can communicate that the parameters and the schedule well, I think that goes a long way to engaging patients.
And Meg, I want to bring up, you brought up the first half of the question from Oni, if I'm saying her name right. She was asking about recommended frequency, but also saying that they have a care team that is sort of all on board with SMBP, and they're getting some comments back from patients that they're getting too many calls. And so I don't know if either of you guys have any thoughts about that. Clearly, you don't want to push the patient. That's not patient engagement. That might be patient harassment, or they might feel like it's harassment.
Right. I think we always got to respect the autonomy of a patient and their ability to say, I've had it, I'm good. Like you can stop working with that. I think, but again, I think it's about what Kate was talking about earlier, which is using the right sort of strategy so that this is a shared decision, and that you are, as the provider and the care team, are letting the patient know where you start and stop, where they start and stop, what they can do. It's really having that opportunity to share the decisions.
And there's another answer, and really appreciate everyone participating in the chat, as an answer to the question of how do you sell this, from Kimberly, who's saying, what would prevent you from making this investment in yourself? I think, Kate, that gets at your
Excellent
comment about make sure you understand what their obstacles might be. So thank you very much, Kimberly, for that suggestion.
I love that. Yeah, that's great phrasing.
Yes. I love that. What would stop you? What's going to make you not do this?
And then Sarah Eve also responding to the too many calls, saying that at a certain point, the in-between site visit communications can be curtailed at the patient's desire. I wonder if a concept of patient engagement sort of early on, like the correct engagement early on of making sure they understand what they're doing and that they're giving the feedback and you're giving the right encouragement, and maybe from there you see a cadence that works. But it feels like getting the individual hooked into measuring their blood pressure, reporting it back so that you can do what needs to be done with to control their blood pressure is the most important thing. Any other questions from the rest of the team? I'm not seeing others in the chat, and really appreciate both the questions and the plethora of answers. This is exactly why we have this forum. We know that besides the wonderful speakers that we gather, it's those of you that are implementing that also have great advice. And so really appreciate the robust use of chat. Does anybody have any other questions for Deb and Kate? And then we'll go on to see a lovely patient engagement video. Let's go on.
All right, I think I have the responsibility of introducing this patient to you. This patient is somebody, and really I want to call him a participant, a consumer. He joined our SMBP initiative that's been funded, and we're grateful for the opportunity through A Million Hearts to deliver SMBP in a trusted space with the engagement of a pharmacist as well as primary care provider. And it's been at his church. He has been faithfully taking his blood pressure since the end of March when we enrolled him. And we are collaborating with the health center and their PCPs there, Spectrum Health Center in West Philadelphia. And when we met him initially, his blood pressure was high enough that we were like, do we need to call an ambulance? And today I'm proud to tell you that his blood pressure is less than 130/80 and has been so for about, I don't know, 6 weeks or so. And we met him in March, the end of March. So I think I'm anxious to hear your reaction to him. And I think with no further ado, we can go ahead and run the video.
Hi, I'm Dave Garnett. I'm a member here at Christian Stronghold. I'm retired from Social Security. And what else can I say? I have one son, magnificent son, who's now married. And I stay out of his business. So, well, sure. Actually, the blood pressure cup to me is extremely valuable, very helpful. I had no idea how serious the blood pressure situation was with me. A number of people really started to panic. I keep that blood pressure cup with me at bed. I get up in the morning, I test myself, I take my medication. I get in the evening, I get in bed, take my pressure. It's connected to my cell phone, and it automatically is sent to the doctors and the pharmacy and so on and so forth. This is extremely important because, one, I'm getting older. You know, I'm in my 70s now, and it's hard for me to walk around. And a couple of years ago, I was hospitalized with congestive heart failure. I don't want any problems, and that cup tells you what everything is. It automatically sends information out. I get communications on my cell phone from I guess it was the other doctors and the pharmacists. To me, it's perfect. It's wonderful. It keeps me in tune, and there's no way I'm going to get up without checking myself and making sure it gets sent in. And the same thing at night. Sometimes it may be as late as 8:30 or 9, but most of the time, you know, it's around between 6 and 7 in the evening. I get that out. I talk with the medical people, and they make the suggestions, and that's what I have to do. That's what I do. I don't want to pretend like I'm a pharmacist myself. You know, no, I do. I take the medication. There have been once or twice maybe, because prior to getting the cup, there were times where up and down, and I would take medication, maybe not take medication, depending on how I felt. But this is serious. This is serious. So they said do it. I'm going to do it. Well, what comes to mind to me is that the cup gets your the numbers, and it sends it right out. There's a connection, electronic connection or whatever, connection to your cell phone or to my cell phone. It sends that information out. The medical people, doctors or pharmacists, can see that, and then they will contact you. I've had text messages sent to me. All right. Yeah. So that's like having a doctor there all the time, you know, and that works for me. I don't pretend to be a doctor, you know, I don't pretend. No. They said I was in bad shape. I don't want to check out yet, you know, I don't want to check out yet. So I do what it says do. Information gets sent out. They send me a text. I get right back. Cuff is easy to use. There's no problem. You slip it on, you know, push that button, and it'll send the information right through your cell phone. You don't have to connect anything. It's done electronically, I guess, you know. Yeah. And that's a wonderful thing to have. Wonderful thing to have. You can stay on top of things, and I've gone to doctors, you know, for other things, and they ask about it, and I would always have my cell phone, because on your cell phone you have a record of all the information that the cuff has given, a historical record. So I push a button, and they'll see a whole history of what my blood pressure has been, up and down, and so on and so forth. So it keeps them on top of things also. I like doing this. It's easy, it's simple, and it's helpful. It's very helpful.
And I see some hand clapping. Thank you, Deb and team. I know that patient interaction, the patient outcome warms all of our hearts as far as knowing that this work matters, and that this is doable. And then seeing an individual that has made the changes with the healthcare team, you know, to really be preventing some catastrophic results is awesome. We have time for additional questions about that video, or reflections from folks related to that video. So opening the mic up to anybody who might want to share. I see lots of excellent video, great video. Thank you. Any reflections from the team in seeing this?
Well, he's been a joy and a pleasure to work with. And as you can imagine, he makes us feel good every time we see him. But I think one thing I will share is that, you know, we were able to move him with the help of the primary care providers as well as the pharmacist to a single pill combination that kind of was life-changing for him, because it controlled his blood pressure without being a diuretic. And this man takes many buses every day. That is his routine. And he was not taking medication because of that side effect. So and there's another sort of happiness in this, is he started taking his statin again as a result of all of this. So it has been all around a very positive situation.
Wonderful. And I think he's the best salesperson for SMBP that I've seen. It's a great story. And I love what you just talked about, Deb, in terms of, you know, the team really dug in with him about where his challenges were and found a solution, which oftentimes we can. We just have to ask.
Yeah. Right.
And I think that speaks to the power that SMBP can have on patient engagement writ large. So as we were doing today's session, I was thinking patient engagement about SMBP, but SMBP and the information you get can be just a gateway to improve patient engagement, where there's a very concrete piece of information to go back and forth and to sort of dig into, you know, what are some of the obstacles. So great example.
Go ahead, Judy, I'm sorry.
No.
There's a question in the chat, how many were on the team? We had enrollment specialists, 3 nurse practitioners that were available to the patients, and a clinical pharmacist on the team. And then I was basically there just to do project management, make sure the cuffs were there, that sort of thing.
Thank you. And I think we will, with that, thanks. And there's been a couple questions about, can we get this video? Yes, the link is in the chat, as well as when you get the slides, this will be embedded. We have permission from this lovely individual to share his story. So as you find it helpful, and as you run into clients and have the ability to potentially have something similar, I really think the patients speaking to patients can be really powerful. So don't hesitate to share on this call at future times or with Million Hearts and the NAP team. With that, I think we should move on to updates and resources. Rita?
Yes, we can go ahead and do that. Sorry, I was coming off of mute. Thank you so much, Judy. And thank you so much again to Kate and Deb. Like, what a great conversation. Really appreciate all the information you shared today and all your conversation. On this slide, I will turn it over to Haley to give us an update on the Live to the Beat pulse check.
Thank you, Rita. Hopefully everyone's familiar with Live to the Beat. It's a campaign developed by and for African Americans to help adults take steps to prevent cardiovascular disease. And it really is grounded in that lived experience data. So extensive focus groups and interviews were used to inform the key tenets of this amazing campaign. A tool I'm going to highlight today is the Pulse Check. It's a tool to engage Black adults in making lifestyle changes specifically. And it has a approach to engage folks in finding out which of the key components of lifestyle changes they can engage in, including blood pressure control and elements of SMBP. So wanted to highlight this tool and encourage you all to check it out if you haven't yet, and help us get the word out about Live to the Beat and this opportunity for folks to engage in activities in a really fun and positive and uplifting way. If you've seen any of the PSA videos, you know the energy of this campaign to help get the word out and engage folks in lifestyle changes. Thank you so much.
Great, thank you so much, Haley. And also, you know, we have some additional stories you can take these links and share it with your patients as well. We some years ago did some videos on D'Angelo and on Natalia, and also capturing their stories and managing their blood pressure and using the SMBP devices to take their blood pressure at home. So please check out these 2 videos in addition to the one you watched today. These are other 2 great narratives that would be beneficial and inspiring to your patients as well. Lastly, we just want to share a few final resources that we have. I know we've shared a few of them throughout the conversation and they've been addressed, but we do have a couple of different toolkits. We know we've shared the SMBP implementation toolkit, where we talked about the protocols and the workflows that are there. We also have this worksheet on how to use your home blood pressure monitor, and it comes in English and Spanish, which would be great for patients who are non-English speakers. So really want to make sure that you've tapped into not only resources shared in the chat, but also in the resources that are shared on these slides as well. And lastly, we have a few upcoming events. So on June 27th, and July 20th, NAC will be hosting some LinkedIn Lives, really talking and having some more intimate conversations, but brief conversations on cholesterol and blood pressure control. So the first one will focus on cholesterol management and statins, and the second one on July 20th will focus on blood pressure and a new recent manuscript that our team published on SMBP. So be looking out for more information on how to access those. We also have the upcoming Million Hearts Learning Lab, which is going to be improving blood pressure control among African Americans, strategies for reducing health disparities. So that is on July 19th. And there is a registration link and more information for CME credits. Lastly, as we move up towards our September SMBP Forum, you will also see there will be the hypertension scientific sessions in Boston through the American Heart Association. So please feel free to check out that link and register for that event as well in person. And I believe we had one question or one person who had their hand raised, and I believe I unmuted them. So yes, Allison, I think you're off mute if you want to share your update.
Thank you so much. This has been a great program. In addition to these other wonderful national events, I want to provide a heads up, and I'll put a note in the chat in a second, that Target BP will be debuting some new attestation criteria, building on those that are associated with measurement accuracy in the recognition program now. And we're going to have a preview and a public comment period. We hope that you can join us for this event and weigh in with your insights and needs. We'll be sharing the new attestation criteria that will address systematic and evidence-based practices that are aligned with health equity priorities, as well as the AMA MAP framework, which would include acting rapidly, partnering with patients, and SMBP. We're going to highlight the resources that are available to help support quality improvement and achievement in this space. And as I mentioned, have a stakeholder survey where you can weigh in with your comments and needs. The save the date will be July 27th at noon Central Time, and there'll be a registration link available shortly on the Target BP website. So I'll put that in the chat now, and I hope you all can join us. Thank you so much.
Thank you so much, Allison. Really glad you're able to share that update with us. So of course, as we shared the link to the survey, and it will also be shared out in our post-call email, please let us know if you have any resources or updates. We are happy to take them and share them out with the group. So please send them to millionheartssmbp@nac.org so that we can hear more from all of you, because we've seen there's a lot of great resources in the chat. And to those who are asking, yes, we are saving this chat and we'll be able to pull out information and resources from there. I want to actually ask Judy, do you have any closing comments before we wrap up for the day?
Yeah, just a huge thank you to everyone for pulling this together, and for the participants. The chat was exactly as we're looking for, both questions and answers coming from those of you in the field. That's the purpose of this forum. And we still have, I believe, the survey is open and you can still complete that. Is that correct, Rita?
Yes.
And just want to emphasize that today's session had everything to do with those that responded early about what some of their biggest challenges were, and it was patient engagement. So we are 100% committed to making sure that we're addressing the issues that you find the most challenging. So please, if you didn't have the few minutes at the beginning of this call to participate in the survey, please do. We will take that into account. And just thank you all for your participation. Have a great day.